Hello everyone, good morning. My name is Dr. Adil and I'm going to talk about today. I'm going to start with the first lecture of ENT or otolaryngology and the different parts which we are going to study in ENT are the nose, the ear, and the throat. So the first thing which I choose to start with is the nose, and um, this is the first lecture of ENT, so let me explain something about ENT. Um, ENT is a very easy subject, you can say, because you just have to study about three major structures and the diseases related to that, and there are just few important topics which you have to cover to master, not to master, but to go through your um, graduation, okay, or to pass the exams of ENT. So, as I choose to start with nose, so I'm going to start with the anatomy and physiology of the nose. And like whenever we study anatomy of anything, we talk about how it looks, okay, and what it is made up of, also what the structure looks like, and of course what are the boundaries of that thing, and a very important aspect of the structure is what are the nerves which supply that structure, what is the blood supply, and what is the lymphatic drainage, okay. And physiology, as we all know that it is related with the functionality of anything. So and we will go by this way. First we will study the anatomy and physiology of the nose, and then I'm going to talk about few of the conditions or diseases related to nose, and then we will start with mm, anything like ear or throat, and then again we will talk about the anatomy and physiology of ear, then the diseases, and then the last thing, the throat. So first anatomy and physiology, and then I will talk about the different conditions. So to start with, how the nose looks like, how we can define that. There is we can divide it into external nose and internal nose. So what you can see when you're talking with someone, uh, so what you can see with your naked eyes is the external nose, and the parts which you cannot see is the internal nose. So how we can define external nose? Of course, it is a triangular or pyramidal shaped structure with its root up and base directed downwards. And it is divided into two main, like I'm talking about external nose. So the external nose, it is made up of bony part and the cartilaginous part, or the bone and the cartilage. um, and if you can feel your nose, yeah, you can see that, you like the lower two-third of your nose is quite mobile or movable, whereas the upper one-third of the nose is fixed. So the root or the upper part is the bony part, whereas the base or the lower two-third um, is the one which is cartilaginous part. So the bone which form the upper two-third of the nose here, upper one-third, sorry, of the nose is made by nasal bone, and you can see over here also the upper one-third is made up of bone, the nasal bone, and the lower two-third is made up of cartilages, which is also called as cartilaginous part. So coming back, you can see, as we are talking about anatomy, so you can see a lot of surface markings over here. This one is the root, this one is the tip, this one is the septum, nostrils, wing, or you can say alar, and dorsum, or you can say bridge. So moving on. Um of course, the skin is covered. When we see it, the skin is covered by nasal skin. Okay, and of course, the skin covers all the bones and the cartilages, and the skin is quite mobile over all the structures. You can feel it. It is thick also, and it have a lot of sebaceous glands, and that's why, um, like when you will touch a nose, you are going to feel a lot of greasy things. Okay, because it have a lot of sebaceous glands. And that's why, because it have a lot of sebaceous glands, sometimes there could be a tumor called as rhinophyma. Okay, all the conditions which are related to nose, you will find this word rhino, rhino. So what I'm talking about right now is called as rhino, rhino, phyma, rhinophyma. Okay, so that is due to it have a lot of sebaceous glands inside the skin. Anyhow, if I will talk about the cartilaginous part, for example, you can see over here there is a lot of information given about the subcutaneous tissue, how many layers are there. Periquadrium, chondrium is the covering on the bone. Okay, so if we will go into the cartilaginous framework, these are all the, you can say, the surface markings. Okay, this like the name of different parts of the bone, and again this one is the one which is all the surface marking, the things which you can see on your body, and you can give them names. So we call it a surface anatomy. So you can see over here, if we will talk about the cartilaginous part, which is the lower two-third part, this is the best, you can say, photograph or picture photo in which you can see. So it consists of upper lateral cartilages, you can say upper lateral cartilages, okay, and lower lateral cartilages, or called as alar cartilages. Okay, this one. So if you can see over here that there is upper cartilages and lower cartilages, or alar cartilages. Also there is lesser alar cartilages, and there is septal cartilage. What is the septal cartilage? The cartilage which is dividing the nasal cavity into two compartments. Like we have two nostrils, okay, and both of these nostrils are separated in the middle by a cartilage, which you can see over here, or inside. It is called as the septal cartilage. Why this? I'm talking about the septal cartilage and insisting that, because when we will move forward, there are many surgeries in which many people, they have deviation of the nose. So this septal cartilage is the one which they are going to perform surgery on, and there are certain conditions in which this septal cartilage can be damaged as well. So that's why I'm talking about the septal cartilage. So these are the upper lateral cartilages, okay, and this one is the lower lateral cartilages, or alar cartilages, okay, and each alar cartilage, if you can see, it's a U-shaped cartilage, and there is lesser alar, or this one minor alar, or lesser alar, or they are also called as sesamoid cartilages. Okay, these what I'm talking about. So sometimes they are two in number, sometimes they are three in number, sometimes they are four in number. So anyhow, like that's not important. They are like placed laterally. See over here. Okay, these are placed medially. This is also medially, and inside there is a septal cartilage. So That's pretty much about the cartilages. Okay. And I already talked about the nasal skin, which is covering that. So, and this is all about, you can say, the external nose. So, bony part, cartilaginous part covered by skin, have a lot of sebaceous glands. Don't forget the septal cartilage. Many surgeries are performed in that. Okay. So, okay, if you can see over here, what it's written over here is um, about the nasal valves. So you can see, like, the lower edge of the upper lateral cartilages means right here, or you can say here. Okay, basically, uh, they are the one which make the nasal valve, and sometime, of course, like whenever your uh, uh, nose is blocked, you can say, so we can do a test called as Cottel's test. Not clinically so important. So how we do Cottle test is, like, you can put your hand over here, and when you are going to put some traction or pressure laterally and downwards, so if your nose is blocked, so it will open on that side. Like, that is simply because the nasal valve will be open. It's not a true valve, but uh, it acts like a valve simply. Not so important clinically, by the way. Okay, so nasal musculature, you can see, like, there's a lot of nose muscles which are there. They are not clinically important. Okay, and no need to remember the names of that even. So that's it. And see, the external nose is supplied by what? Facial and ophthalmic arteries. And remember, guys, nose have very extensive blood supply, of course, and face in general have a very high blood supply, and that's the reason whenever anyone get any injuries on the face, they heal very fast. Why? Because the blood supply is very good, and lymphatic drainages go to the pre-auricular and submandibular lymph nodes. This is what is the nerve supply of the nose, or external nose we are talking about. And of course, like, the nerve supply, or you can say the sensations, are taken from the face by which nerve? That is the fifth nerve, trigeminal. It have three divisions. One is ophthalmic, submandibular, and maxillary division. So the nose is the one. Of course, the sensations from the nose are taken by trigeminal nerves. Okay, nerve and nerves, in case, like, if you count both sides. So that's how the sensations are taken. Anyhow, move forward, and we will start talking about the internal nose. Okay, now internal nose is the one you can see over here. Before, we were talking about what we can see outside, but now we are concerned with all this thing, which is basically opening behind into nasopharynx, opening in front into nostrils. It is bounded above by cribriform plate, which is the one which is separating the nasal cavity with the anterior fossa. Here is your brain. Okay, and this plate is called as cribriform plate because this one have a lot of pores, or you can say fenestrations, or you can say holes. Okay, from where the olfactory nerve comes, and that's how we can smell the things. And down, there is a bone, or the palate, or the hard palate and the soft palate you can feel. So this palate is basically making the roof of your mouth or oral cavity, and the floor of the nasal cavity. Okay, so now we are going to discuss all the structure, internal nose or nasal cavity. Okay, so the anterior and inferior part of the nasal cavity is called as vestibule. Okay, and all the rest of the nasal cavity is called as nasal cavity proper. um, there is a lot of you can see, like, this one is the nasal cavity showing the blood supply. This one is the nasal cavity showing the nerve supply, and this one is the anatomy of the lateral wall of the nasal cavity. Again, the blood supply of the lateral wall of the nasal cavity. Anyhow, we'll talk go on this thing a little later. So right now we are talking about the nasal cavity, and if you can see over here that there are different bones which make the nasal cavity, like ethmoid bone is there, the septal cartilage. So what they're showing right now is they cut the you can say the cross section of the face exactly in the middle. So you can see, like right now you are not seeing the lateral wall, because to see the lateral wall we have to remove all the structures, and then we can see the lateral wall, which will look somehow like this, which have like the turbinates. Okay, so when, like right now you can say this is the central wall of the nasal cavity here. So these are the different bones which is making the central wall, like ethmoid, septal cartilage, as well as the vomer, right? So anyhow, this is called as the nasal cavity proper. Okay, the important thing here is what, clinically, this the lateral wall of the nose is very important. Why? I will tell you in a while. Okay, this one is the anatomy of the lateral wall of nose. Okay, and basically these projections are called as turbinates, and the important thing is what, like there are openings, small openings behind these turbinates. I will show you in a while. For example, the opening of your nasolacrimal duct, like your tears, which are in your eyes, when they drain into the nose, and that's why whenever someone cries, they had their nose started running, because the water which is formed in the eyes comes from nasolacrimal duct, and it is drained here, which started running outside. Um, for example, sometimes when the babies are born, they have blocked nasolacrimal duct. So what happened? Their eyes become runny. Why? Because like when the fluid or the tears or the secretions which are formed in the eyes, they cannot drain. Like I can tell you the opening. See, this is like, okay, what they did in this photograph is they cut the turbinates off. Okay, they removed these turbinates, they remove this one and this one, to show you what's behind that. And when they show you here, see, there is the opening of ethmoid sinus. Under the middle turbinate, there is opening of the frontal sinus, ethmoidal sinus again. Okay, as well as maxillary sinus opening, and below the inferior turbinate there is the opening of nasolacrimal duct, or simply the drainage which is coming from your from your eyes. Okay, so inferior turbinate is basically a separate bone. Okay, and below that there is what you can say, the opening of the nasolacrimal duct. Okay, um, this area is a part of ethmoid bone. Okay, and it have a lot of openings, you can see over here. Ethmoidal sinus, this is called as bulla ethmoidalis. Opening of frontal sinus is also here, so many sinuses they open over here. Whereas the um, I will talk about the bulla ethmoidalis in a while. Okay, just like if you're thinking, I'm skipping that. Okay, and the superior meatus, or like the superior turbinate, when we remove that, what we will found is the opening of the posterior ethmoidal cells. Now, uh, what is bulla ethmoidalis? You can see over here, they have written over here, right? What is bulla ethmoidalis? Um, Basically, behind this, there are ethmoid cells, okay? And what are these ethmoid cells? Basically, these are the sinuses. Like the bones of our face, you can see the maxillary bone, for example, is hollow inside, and the air circulates in that. And sometimes, people, they get sinusitis, they get frontal sinusitis or maxillary sinusitis. What happens, like these bones, like the frontal sinus, which is above your eyes, when we will go to that topic, we'll talk about that. Sometimes they get inflamed, sometimes there are secretions in that, and that's the reason people, they feel a lot of headache, okay, whenever they get inflamed. So basically these openings are the one which help them to ventilate. Whenever we inhale or exhale, whenever we inhale, the air currents, they go inside the bones and they ventilate them. Okay, so the bones of the face or the front of the face are basically hollow, and they are the one which are making sinuses. So bulla ethmoidalis is ethmoidal cells which are basically behind this unicate process. If you will open like in any anatomy atlas, you are going to get like exactly how they are located. Okay, so like this is the importance of this thing, like these openings and all these things. Okay, and why, what's the function of that? So this thing is done. Now, as I told you, the medial wall is made up of the cartilage. Okay, so lateral wall is important. The roof is, I already talked about that. The roof is made up of what? It is the made up of cribriform plate. Okay, of course that is a part of ethmoid bone, but it is called as cribriform plate. Why? Because it have a lot of fenestrations or holes through which the olfactory nerves come down and cribriform plate. Okay, and you can basically smell the things. Okay, so that is roof, and then the floor, as I already told you, that is made up of what? The hard palate, or you can say the palatine process. Okay, palatine process, palatine process of maxillary bone. Okay, and behind that, there is soft palate. So this is how they are formed. Okay, so like that is the boundary. So I think you if when we will remove the central part, okay, or the cartilage, we can see the lateral wall, and they are made up of different bones. Above there is cribriform plate, which is separating the nasal cavity with the from the anterior fossa of the brain. Below is hard palate, which is separating nasal cavity with the oral cavity. Okay, anteriorly it opens into the nostril, and posteriorly it opens into the nasopharynx, which continue down to oropharynx, which continue down to pharynx. Okay, simply. Now, I will tell you the importance of like why we are studying this nasal cavity and what's the importance of that. This medial turbinate and middle turbinate and superior turbinate and inferior turbinate. These processes or bony processes are covered by mucosa, and whenever you get like some infection, upper respiratory tract infection, or allergies or anything, this mucosa basically swell up, and that's the reason you get runny nose all the time. The water come out from the nose, and that's the reason, by the way, you feel that your nose is stuffy or blocked, and that's again the reason that some people, they use you can say decongestants or sympathetomimetic drugs like oxymetazoline, and when they sniff that, it causes vasoconstriction, and that inflammation goes away, and you feel symptomatic relief or relief of that blockage. Yeah. Anyhow, to move on, the most important thing, guys, in this lateral wall is the blood supply. And why the blood supply is important? Because simply the reason is that the nose is supplied by many arteries. See, there is anterior ethmoidal artery, there is posterior ethmoidal artery, there is phenopalatine artery, there is greater palatine artery branch. Greater palatine artery basically gives a branch, and there is superior labial artery. Of course, like superior labial, it is the one which is supplying your upper lip. If you can see over here, all these arteries, they converge together and they make a plexus over here. Now this plexus is called as Little's area, okay, and the other name of this one is Kizil-Black's plexus. You can see Kizil-Black's plexus or Little's area, okay. So you know, epistaxis is the medical term which is used for nosebleeds, okay. So nose bleeding is very common in children, very common in adults, very common after trauma, very common after dry weather. In simple words, this nosebleeds are very common. Medically, we call them as epistaxis. So, as you know, whenever anyone can, uh, like sometimes like someone is doing nose picking and you can hurt some area and suddenly the blood will started coming out. So the blood basically comes like this is the area which have the most extensive blood supply. All the arteries, they converge and they make a plexus over here. This plexus is called as Kizil-Black's plexus or Little's area, and this is the importance, like this is the part which can bleed easily and can cause epistaxis. And this is the part again, whenever anyone is actively bleeding, first of all we try to put some pressure, pinch the nose, okay, for like few minutes to stop the bleeding. But if it is not stopped, what they do, they do they can do a direct cauterization. Cautery, cautery or cauterization is simply to stop the bleeding. Sometimes they do anterior nasal packing, like they put some dressings inside the nose just to create some pressure and stop the bleeding. So this is one of the things which is very important to remember about the lateral uh, wall of the nose, that this is the area which is very vulnerable, or you can say there are high chances that this area can bleed easily, okay. And if you will notice, like especially in pediatric babies, or like babies simply, whenever it is, you can say, a very dry type of weather, especially in winters, when there is like you are using a lot of heaters inside the home, so there is too much dryness, and sometimes the babies, they have nosebleeds, even adults, not just babies. So that's one of the very important point to remember about this thing. Never forget what is Little's area or Kizil-Black's plexus, okay. um, the nerve supply to the nasal septum, I will talk about that, though it's not very or so important. So olfactory nerve, as you know, like this is the nerve which is the first cranial nerve, and guys, remember, like this first cranial nerve or first and second cranial nerves are not considered as true cranial nerves, but they are included in cranial nerves. You have to remember them as cranial nerve because they are cranial nerves, but not true cranial nerves. So, like, of course, like olfactory nerve, which is the first cranial nerve, is the nerve of smell, and it comes from here, and there are small holes over here, and it projected fibers inside this cavity, and you can say, um, because of this nerve, you can smell the things, okay. And again, why I'm talking about this thing again and again, like there are small holes over here, because see, here is brain, there is CSF or cerebrospinal fluid which is running over here, right? And there are small holes over here, And when some bone have a lot of holes, of course it can become weak. So sometimes, okay, whenever you have runny nose or water is coming out from your nose, we call this condition as rhinorrhea. Okay, rhino. Rhino would be like nose, and oria, orrhoea. I can write over here just to tell you. rhino. Rhino means nose. Okay, and again orrhoea, like runny nose. Okay, water from the nose. So sometimes, for example, in trauma, someone had trauma and they have runny nose after trauma. So maybe there is a fracture over here, and the CSF, which is over here, it has started leaky, and now it is coming from here. So we call that thing as, just add CSF rhinorrhea, like CSF is coming out. So clinically, when you're dealing with some patient and you don't know, either it's simply runny nose, or the water is coming from the nose, nasal mucosa, or either it's CSF, which is quite dangerous, because anything related to brain can be dangerous. And of course, like, the infection can go from here to here, can cause meningitis. Okay, because meninges are there, which are in close proximity with the nose. So we can collect some water from here. We can do a CT scan, of course, to see the condition of the bone. We can collect some water and test it. Either it's CSF, or either it's simply water coming from the nose. Okay, so like, this is one of the important point. You can say, like, what is rhinorrhea and what can be CSF rhinorrhea, what are the conditions. Okay, otherwise you can see like other sensations nerve. There is anterior ethmoidal branch of nasociliary nerve, there is nasopalatine nerve, there is anterior superior alveolar nerve. Guys, not so important simply to remember the names of these nerves, because simply they are not so important. Like, in different exams, whatever you are doing, there are very less chances, like someone will ask you the nerve supply like this, but there are higher chances people will ask about sinusitis, people will ask about CSF rhinorrhea, people will of course do ask about epistaxis. Okay, that is, you can say, a very high yield type of topic, epistaxis. So simply, and of course, like, there is autonomic nervous supply to the nose as well, and that's the reason, um, whenever there is weather changes, the mucosa inside the nose, it keep on changing. So there is parasympathetic nerve fibers which supply the nasal glands. Okay, and when they supply the nasal glands, of course they are the one which are controlling the nasal secretions. Simple words. Okay, so you can found over here. Okay, I will go slowly through all the slides. Okay, so that if you want to see anything for your reference, you can stop over there and you can take some notes or take a screenshot simply. Okay, uh, like, this is the normal nerve supply I'm talking about right now, about this thing. Yes, this is a very good photograph. You can say olfactory nerve is the one which is sending the fibers, okay, inside the nasal cavity. Okay, and this is also the nerve, this is also a nerve. I was talking about this thing, superior alveolar nerve. I was talking about this thing right now. Okay, I'm not very good in this, slide teaching. um, like, I even didn't knew like there was a slide better showing what I'm explaining. So anyhow, uh, this is the arterial supply. I show you this one. Okay, and see, this one is the area where there is a lot of nosebleeds, and see all the arteries which are coming, they are anastomosing over here. anastomosis, like different arteries, they are interconnected. Okay, I will talk about this thing. Okay, so right now I was talking about the nerve supply. So parasympathetic nerve supply is there, which control the nasal glands and of course the nasal secretions. Okay, now they are the one, of course, when parasympathetic nervous supply is what you can say is activated, what will happen? It is going to cause vasodilatation, and sympathetic nerve fibers also comes, okay, from there, and they basically come from superior cervical sympathetic ganglions, of course, from the third thoracic vertebra. Okay, the sympathetic outflow which is coming from the thoracic vertebra, it is coming from there. So, in simple words, whenever the sympathetic nervous supply will be activated, what will happen? It is going to cause what? Vasoconstriction. Okay, and that's again the point which I was talking about. That whenever someone have allergies, whenever someone have rhinorrhea, and whenever someone have stuffy nose or nasal blockage, they can take oxybuthazoline, which is a sympathomimetic drug, and which can simply um, open the, what you can say, the nose. Okay. Um, Last but not least, lymphatic drainage, guys. The lymphatic drainage from the nose simply goes to the jugular nodes. Okay, like which are in your neck, of course, and from where they are further drained. So that's pretty much about what you can say. Okay, this one is like explaining the same thing. Osteomeatal complex, I told you. See, this one is the middle turbinate. Actually, though that photograph, they remove this thing and they show you this thing. And this is bulla ethmoidalis, which is like collection of some cells. And again, they're talking about the same thing. Nothing special. So, as I told you, bulla ethmoidalis is ethmoidal cells. That's it. Okay, and they are located directly below the moon. Okay, yes, one very important thing, guys, which is important. I will wait. Let me go there. Okay, dangerous area of the face is this triangle. Okay, why this is called as the dangerous area? If you can see over here, and this is like you can say the clinical correlation of that thing, the lower part of the external nose and the upper lip, or simply this area and this area, okay, whenever there is any infection in this area, it can spread to the cavernous sinus. Okay, cavernous sinus, if you know from your initial days when you were studying anatomy in first year or second year, cavernous sinus is a very important structure, and many important nerves they pass through that. And whenever, of course, like anything I told you which is related to brain can be dangerous. There is, if the infection will go to the cavernous sinus, it is going to cause a lot of, you can say, dangerous scenario. So infection from this part can spread to cavernous sinus simply via inferior ophthalmic vein, okay, via anterior facial vein, which have no valves, simply. So that's why this is called as dangerous area. So whenever you have any infection in this area, any infection can occur. It can spread directly to cavernous sinus, okay. So that's why it is called as the dangerous area of the face. So to talk about paranasal or nasal sinuses, as I was talking about, you can see here, these are the frontal sinus. Very commonly, people they get frontal sinusitis. They feel pain above the eyes, especially in winters when you have some sort of upper respiratory tract infection. There is maxillary sinus, which is in your maxillary bone. There is ethmoidal sinus, small sinuses, and there is sphenoid sinus, which is also small sinuses. So again, one more photograph of this thing. Again, frontal sinus, maxillary sinus, ethmoidal sinus, and sphenoid sinus. And as you can see, if you will pay some attention, what is this? Middle turbinate, and maxillary sinus is opening over here. Okay, so simply all the sinuses, they open in the nose. Okay, and I will not go in more detail of the sinuses because of course, like they are written in the anatomy books, and you know what are the boundaries of that thing. Okay, what is the boundary of the maxillary sinus? And okay, maxillary sinus are the biggest one. You can see over here, capacity is 10 to 20 milliliter. Okay, whereas frontal sinus have the capacity of 5 to 10 milliliter. They are the second biggest one. What are the boundaries of that? And ethmoidal sinuses are very small. Okay, and they are divided into anterior and posterior groups. And again, what are the boundaries of that? And sphenoid sinus, of course, like they are very thin, small. You can see in that photograph. Okay, and where they are located, you can see from that photograph as well. Okay, so sorry, I will talk about a little about how we examine the nose. Okay, um, like why examination of the nose is important. Sometimes, of course, if there is any polyps, like what are polyps? Polyps are, you can say, hypertrophic mucosa. Okay, sometimes we have to see that. Sometimes we have to examine the nose to stop some bleeding. Okay, sometimes there can be some tumors. Sometimes, so in simply, yes, fractures can be there, trauma can be there. Okay, a hematoma can be there. People have DNS, like many people, they know about DNS. What is DNS? It is deflected nasal septum. Sometimes you have to examine the nose just to see like either the septum is deviated or not. But nowadays, of course, things are done by um, the help of imaging like CT scan and things like this. So of course, like whenever we do any examination, we first of all we see the structure, we see like how it looks like, what is the general appearance. We note like either there is any secretion coming out, either there is any inflammation, redness. We check the temperature of that, look, feel, and move simply. So we check any redness, area of redness. Then we can take this small thing. It is called as anterior rhinoscope. It can open the nostril, and then we can see inside what's in the nose. And then there is something called as posterior rhinoscopy. What is that? Is simply they can put okay, not this one, I'm sorry, not this one. Okay, simply okay, I think like that photograph is not available of the posterior rhinoscope. A posterior rhinoscope, like if you Google that, you will see like it's simply a mirror. You can say a small stick which is attached with the mirror at the end, and they can put that thing inside your mouth, and what they can see is like this area. Okay, they can put inside your mouth, and with the help of that mirror they can look up. Okay, of course, by throwing light on that mirror. Foreign bodies are very important in kids, you know. Sometimes they have foreign body in their nose and we have to remove, for example. In that case, of course, like nasal examination is very important. Simply, there can be many of the clinical situations in which like the nasal examination can be important. Again, this is some more explanation about the sinuses. When we will study sinusitis, I will talk about sinuses more, even discuss some more anatomy. And this is like the drainage of sinuses. You can check the numbers, and you know, of course, these photographs are taken from different ENT books. So let's start now. You can see over here like anyone who have frontal sinusitis, maybe you will feel pain, or they feel pain above the eye. When you will touch, the area will be tender. Okay, so whenever we examine the nose, of course, we uh, palpate all the sinus area, simply maxillary sinus, pinch on the base of the nose, sorry, root of the nose, between the two eyes, and tap above the eyes to see if there is any tenderness in the frontal sinus or not. Physiology, what's the function of the nose? Then the nose do all these important functions. Okay. The most important function is, of course, respiration or breathing. Remember, guys, mouth is to the function of mouth is not to breathe, it is the nose, and you can say nose is a very good filter. Okay, so the natural way of breathing or respiration is through nose, of course. And whenever the nose is blocked, of course, people go for mouth breathing. Okay, and that's the reason, when the babies are born, they breathe from their nose, and whenever their nose get blocked, they disturb all the night, because when they breathe from their mouth, basically all their airways become dry. They started coughing. Okay, and this thing. So whenever you do uh, inhalation, or you take air inside your lungs, okay, the air, when it passes through the nose, it is the air uh, which goes into the small openings, and they ventilate the sinuses also. Okay, that's very important thing. uh, so most of the air, it passes through the middle part of the nose. Okay, and very little air passes through the upper part of the nose, and that's why, um, if like in the air there is what you can say very weak type of smell or odor is there, you cannot appreciate that. Okay, and that's the reason, whenever we sniff like this, so that uh, we can smell the thing properly. Because if the sensitivity of our smelling will be like very strong, it will be very disturbing anyways, because every time you will be walking, you are going to appreciate the change of smell. So that's why, like, most of the air, it passes through the middle turbinate, not the lower and the upper one. And uh, again, when you exhale or expiration, or when you throw out the air from the lungs, uh, like much of the air goes through the inferior and the middle turbinates. Okay, and it ventilates the sinuses. Okay, so well, one very interesting thing here, I will tell you, is the nasal cycle. See, when we do inspiration, the air directly goes inside the lungs. Okay, but when you do expiration, there is a formation of eddy currents, and this is the one which basically ventilate the sinuses. So the sinuses get ventilated in expiration. Okay, so nasal cycle. If you will notice, you will found that the nasal mucosa, basically you can see over here that it undergoes rhythmic cyclical congestion. So simply, like, if I will pay some attention on my nose, my right nose is right now closed, but or not completely closed, but more air is coming from my left nose. Okay, and this thing keep on changing. Okay, and this cycles last from 2 to 12 hours, of course varies. Okay, this is the range. Okay, every 2.5 to 4 hours on an average, like your one nose will start working or passing air more than the other. Okay, so this is called as a nasal cycle. Now, what I can talk about is, we will go on to the functions again. Of course, whenever we do breathing, our nose is the one which air condition the air. Okay, it filters, it purify, it control the temperature, it controls the humidification. So basically it gives the perfect type of air which your lungs can sustain. Okay, you'll find more what you can say, uh, explanation over here. um, Simply, you can say, it filter the particles, small particles. Okay, your nose can filter up to 3 micrometer, uh, 0.5 micrometer of particles. Okay, and anything smaller than that, of course, you cannot. Of course, like for that, you have to get N95 or N99 mask. These days coronavirus is everywhere, and that's why people are concerned, like they must wear N95 or N99 mask, because uh, those are the ones which can stop like very small particles like viruses. Okay, your nose cannot, of course, because those small particles, they can easily go through and go deep inside the lungs, and that is what needed for coronavirus to occur. So now, due to this turbinates, um, the you can see the surface area inside the nasal cavity is too much large. Okay, and that's the reason you can see that your nose act like a radiator. Okay, what the car radiator do, if you can see the car from the front where the radiator is, you will found that the radiator have very small, you can say, metal pieces, or those things. What happens when the water passes through that and the air passes through that radiator? It cool down the water instantly, and that's what your nose is doing. That whenever the air passes through your nose, what happens is, it depending on, like, either it's hot weather or cold weather. Okay, so no matter the air is coming at 0 degree centigrade or high degree centigrade, okay, it almost bring that to the body temperature. Okay, and it also humidify, okay, or control the temperature as well as the moisture of the inspired air. Okay, so this is when I was talking about, you can say, if you remember from, I was talking about the water intake and outtake from our body. If you remember, there is something called as insensible water losses. So, of course, like the water which we lose during breathing or respiration by the mean of our lungs. So, that is around, you can say, around 1 liter or 1000 ml. So, that is, of course, lost, and your nose do play a role in that. Okay. So, of course, like, humidity in very high humid weather, sometimes you cannot breathe, or it's hard to breathe, especially in Arab countries where the weather is too hot, and the humidity is too high. Okay, why? Because the cilia, they stop functioning when the humidity is high. Okay, so, and that's the reason uh, you are prone to get more infections, because your cilia are not working. What is the function of your cilia? Yeah, like your cilia are continuously in motion, and they are bringing the secretion upward, and they are protecting you against many infections. Okay. For example, smokers, their cilia, they get paralyzed, they stop functioning. Okay. Uh, so this thing, and then of course humidification, I talk about that. Of course, your nose is the one which is filtering small particles, and of course which is protecting you against your lower airways to different infections, to different threats, pathogens. Sneezing is a reflex which is there. If you have something which goes into your nose, it will irritate, and it is going to give the sneeze, which will throw out all the things outside. Okay, that is again a protective mechanism. Okay, then I talk about the mucociliary mechanism. Maybe you will see, yeah, this is the mucociliary mechanism. So all the nasal mucosa, they have a lot of goblet cells. Okay, and they keep on producing this mucus layer inside the nose. Okay, and it acts like the cilias, when they move, They basically move all this thing. So all the things which are trapped over here are move and they are thrown out. That's how you produce nasal secretions as well. And it acts like a conveyor belt, like when you go on the airport, your stuff comes on the conveyor belt. So it is all the time transporting the things, okay, to be thrown out from the body. So of course there is like too much details of this mucociliary. Again, see, this one is like in continuous motion and throwing this secretions, okay, outside. So now it moves at the speed of 5 to 10 millimeter per minute, okay, and all the things which you are taking, dust particles, bacteria, viruses, if lucky coronavirus as well, they are trapped in this one. And of course, like they can be swallowed or they can be thrown out simply, okay. There is around, you can say, almost half liter, more than a half liter of nasal secretions which is produced every 24 hours. Most of that, of course, we swallow that. So this thing, uh, okay, this is like, the factors which affect the mucociliary function. For example, you can say the temperatures, either you're a smoker or not, what is the humidity, and so there are many factors, of course, which play a role. And now, very important thing in this one, they have a lot of enzymes as well as immunoglobulins, okay, of course, which is the first line of defense. Like your stomach have acid, your your nose is there, of course, to clear all these things, okay. Sneezing, as I told you, it's a protective reflex, of course. Then there is a function of I talk about this thing before, okay, like whenever you do inspiration, okay, and whenever you will do expiration, of course, it ventilates the what you can say, when you do inspiration, there is negative pressure, so the air move out, you can say. And whenever like you do expiration, there is positive pressure, the air go in and ventilate, okay, simply. Okay, and now guys, vocal resonance is very important. Okay, this one is like nasal resistance. Of course, the nasal nose do offer some resistance to the expired air, and of course that will help your alveoli to not collapse. If nose is not there, your alveoli don't have any resistance to air. So if, for example, all the air is going to escape, they are going to collapse. But there is surfactant also in the alveoli which help them not to collapse. Okay, I know this lecture is getting a little longer, but we are going towards the end of this lecture. Okay, and vocal resonance. So vocal resonance, of course, there are some people who talk through their nose. Okay, and they sound like they sound like, and sometimes, whenever you get some infections, especially upper respiratory infection, what happens is your voice changes. Okay, what's the reason? Uh, if you say mining, so you will notice that you are using a lot your nose, okay, to say this M, N, or NG, for example. Okay, so when your nose is blocked, of course, when you will say M, N, or G, they will sound like M will sound like B and N will sound like D, for example. Okay, so simply in simple words, nose is the one which do plays in a role in vocal resonance. This thing is important. Olfaction, we already talk about that, guys. It is the one by which you can smell the things. Okay, and okay, I will talk a little about olfaction and then we'll finish this lecture. Um, and nose is also like when we are talking about these nerves, there are many reflexes which are present in the nose. For example, whenever I will give you a very good example, by the way. Whenever you smell like a food which you really love, okay. Now, of course, I don't know the name of many foods, but you can smell anything. So your saliva started secreting, so it is also a reflex. Like you had a smell of that thing, and of course that smell gave you some stimulus or reflex, and you started salivation. Okay, now few terms, guys. uh, what is anosmia? When a is absence, when you cannot smell anything, that is called as anosmia. Hyposmia is like decrease sense of smell. Parosmia is like different or some abnormality with sense of smell. And phantasmia is like perception of odor in absence of olfactory stimulus. Hyperosmia, like when you are too much, you can say, sensitive to any kind of smell. Okay, and like these are like all the terms which apply on that. So simply what happens is olfactory pathway is what, like that, your smell is perceived by this neurons or the nerve fibers. Okay, they have the receptors, and this, they pass the signal to the glomerulus, which is inside the nerve, and from there, uh, like uh, these receptors are millions in numbers. Okay, and simply once, you can say, the all the signals reach to the olfactory nerve, they are sent to the brain. Okay, and your brain is the one, of course, which have a center for smell. Okay, so simply like your brain have the center of smell, and that center, of course, is connected with different areas, and that's why what I was talking about with the reflexes. Like when you smell something, you started producing saliva. Okay, so of course, like this, all centers are connected, and that's why you started what you can say, testing saliva. Okay, uh, uh, this one is like olfaction is disturbed in head trauma and all this stuff. Okay, guys, one very important thing, by the way, is what, um, once, whenever we are going to examine anyone nose, of course, we have to, this thing doesn't comes in examination of nose, rather examination of the cranial nerves. Whenever we examine the cranial nerve, we have to examine the first cranial nerve, that is nose or olfactory nerve. In many of the examinations, usually we don't examine olfactory nerve. Okay, when we examine cranial nerve, we can ask the patient if they have any change in the sense of smell. But even if you have to, um, what you can say, test that nerve, what we do, um, we can give them anything, which produces some typical type of smell, which is quite generally present in us, around us. For example, you can put a orange, or you can put rose water, or something like this, which the people can catch easily. So that's all about the anatomy and physiology of the nose. Okay, if you have any question, you can write a comment, you can send me a message. Okay, hope so you guys enjoy the